Right.
All right.
Yeah, we have a full house and we got a full agenda, so let's go ahead and get started. First off, we're just gonna go to the table because there's some new folks in here. When money is involved, it's a crowded meeting. Right, so let's go around the table real quick. I'm Jeff Bolton, the Chief Probation Officer, and that's my left.
Administration.
Steve Sinclair, probation.
Paul Litchfield, probation.
Ryan River, Health and Human Services Agency.
Jay now, jail lieutenant.
Bridget Arno, CFAO Sheriff's Office. Molly Patrick, Administrative Analyst, Sheriff's Office.
Sam Rathman, Sheriff.
Dan Foster, Medicine City PD.
Shannon Winshire.
Rob Tucker, Board of Supervisors.
Jeremy Vance, probation.
Michelle Bonneman, DA Analyst.
Thomas Angelo, public defender.
Rachel Pena, Public Defender in DSS. Ella Henson, I'm new here. I am the Legal Office Supervisor for the Public Defender's Office. My name is Lola Becerra. I'm with Alliance for Workforce Development. I help youth and justice involved individuals. Lydia Stewart, DA's Office.
Jim Emerald, project clerk. Alex Gamelgard, Grass Valley PD.
Angie Coffey, Probation.
Brian Blakemore, Grass Valley PD.
And let's go up to the screen. Aaron, do you want to start?
Erin Mettler, Deputy CEO, Chief Fiscal Officer.
Phoebe Bell, Behavioral Health Director.
I'm Carrie Yardley. I'm the Clinical Administrator in Behavioral Health.
Hey, thank you. All right, the first thing, I'm gonna move this around to make sure we have more, I don't know if you were counting all those folks. That's also one I'm missing, right? We have a quorum. And so just before we vote, just to go over this again real quickly. So we've gone over the executive committee and who by statute's on that and designees at length, as well as updated the bylaws and all those things. And so the ones that Linda says she still doesn't have anything on as far as naming the designee is Health and Human Services, I think, and the DA's office. So Jesse has to contact me, email, however he wants to do it, and name someone from the DA's office as a designee for the year.
Okay.
Is it positional or is it individuals? I ask because this is the last meeting of our behavioral health director that's taken a position at a statewide agency.
You're saying as far as like,
Who I designate do I have to say Phoebe or can I say the behavioral health director?
yeah, you can say that, that's fine. Fine, Jesse. So you are saying the behavioral health director?
I hereby say it.
All right.
I hereby
If
say
you said, should I, or can I say it? I was like, well, you can, if you want to. Okay. With that, the first thing is approval of the November 13th minute meetings. Those should have gone out with the agenda. And so can I get a motion to approve the meeting minutes from November 13th? Can I get a second?
Do we need to have a designee from the DA's office for me to be able to vote?
Second.
Any discussion? And all those in favor say aye. Aye.
Aye.
Any opposed? Abstain? Right.
Abstain just.
So. Motion passes. Next thing, any public comment? We don't have a ton of public here, I guess, as far as not representing the exec, the Project Heart and Alliance for Workforce Development. I don't know if you guys had anything you wanted to add. No. Okay. So here we get to the budget part. This normally, I don't think we've ever completed it in one meeting in the last couple of years. But we'll do our best. You know, have the framework of a concept of a plan. So should be good to get that done. And so the budget requests, we have close to 600,000 more than this year's revenue. I think it's like 5 something. So it's a little bit more than normal. We have some new requests in there. And so, well, actually, let me go over a couple things in case the budget does run long. Just because this has to come out. We had talked about the Chico state training and for them to come and do a data literacy class. So that's tentatively set up for March 19th. They're going to send out kind of a sign up and a survey to get some more information. But essentially, they can have 30 attendees. It's tentatively set for March 19th, and that will go out, and then we'll set up the place and the exact time that that's going to start. The plan that I have right now is to send that out to the exec members, and you can distribute that to whomever you would like to attend or beyond that. If it goes well and we want to have them come again, then we could figure something out. The only issue with them coming out all the time is the school schedule. So their schedule is kind of tight relative to when they have breaks because they're all teaching up there. So any questions about that?
Is it likely to be an all-day kind of training?
I've looked through the emails and I can't remember the discussion. I thought it was like 4 hours, but I'm not positive. I know that that contract got reached out. I'm not sure if it's that in there.
I'm pretty sure, yeah.
Yeah. And that's a long, for non-data people, that would be a long day of learning about data. The other piece real quick before we get started is the plan. I think I told folks that BSCC sent out a letter, and I have a copy of it here if anyone wants it, that basically when they changed the budget and removed the incentive for doing a plan, they also removed the requirement of it. So we had talked about continuing to do our own plan. And so last time I sent out some examples of other counties. I don't have a ton of time to talk about that today, but the main thing I think in the other ones that I've looked at, and we kind of discussed this when we first switched the request kind of method document to do budget request, there's been a bit of drift on how that occurs. So most of them have basically like a simple logic one. How much of a thing did we do? How well did we do it? And how were we better off in the end? So like the inputs, outputs, and outputs in kind of a simple way for each one of those projects that they fund. And so we lost our analyst and we're going to recruit another one, but for the interim, we have a temporary person that's helping us out with some things. And this is something that I think that he can help us out and kind of design this project to kind of hone in on some of those things that we want to look at relative to the things that we have funded. I'm going to read all my notes here. The other piece is how the meetings run to public meetings. So I get a lot of emails and questions, stuff, especially this time of year. So I'm going to try to be better at, when we set up the budget framework of getting all those documents in a timely fashion, sending those out when we put that public notice out with all those documents and all those kinds of things so that it's in line with how it should be. And then sometimes when there's multiple questions, refer to like when we have the meeting, bring those questions up. And so that everyone can get those answers to those questions, because a lot of them are very similar relative to revenue and funding and those sorts of things. Just so it's all out in the open. So. All right, as far as the budget goes, I was going to start with one question that I already put out there that I told Chairman that I was going to bring up, as well as then start with the items that are new and the items that increased and then move into the items that we've had kind of status quo for the last several years. So the question, and some of the questions that I got were, when we have some of the revenue projections early on, because we do this pretty early, sometimes there's adjustments to it. So currently, some of the requests are based on percentages. And like when we look at it, we kind of look at like how much each person's kind of taking out the pie. And so when those adjustments are made, what mechanism do we want as a group? Do we want to just leave it based on that original assessment or that original estimate of revenue? Do we want to make any adjustments? And so the example is, so like the sheriff's department puts in for 50%. If the revenue comes in significantly lower, do we make adjustments to that? And so like, and I know it causes issues because the budget's already set sail. So that's just a question to put out there. And Angie had some ideas, I think, about possibly about a revise and like other metrics that we could use as to what would be our best one to be able to get the information, but not make it so tight that the budget hasn't already set sail at the county level.
I mean, I have a response to that. I don't think that our allocation has been adjusted upward in the years where more revenue has come in. So that gets added to fund balance. So I would say this is an opportunity to, I mean,
To true up.
or draw down the fund balance to allow for the original allocation.
And that's fine. I just wanted it because I don't want to make, since the way that the statute reads, I just want to make sure that it's out in the open and it's not just me making the decision. Or just going to leave it this way. So if someone questions it as we go further down the road. And that's fine with me. I mean, that's one thing that I asked is like, okay, well, when it goes down, do we also do when it goes up or vice versa? Because I mean, it could be either way. I have a feeling the next few years it might be down more than up, but you know, who knows? The other question that came up was the innovation fund. And so do we back that out first prior to all the allocations going out? So like our basis is, you know, the revenue minus the innovation fund. So
Yeah, I have a question and maybe it weaves into all of this, but you know, I've been on this board for a while now, and I don't know if we've really had much of a discussion around the purpose of fund balance and what a healthy number is, because that might play into today's discussion around, for the first time here, we have some numbers that would actually eat into that a little bit. And then another question I have is around the capital facility contingency fund, and that 600,000 has been sitting there for years on end.
I think
And it hasn't-
since 2011.
Yeah, since the beginning, and it hasn't been used and hasn't grown. Cost of construction has gone up. Is there a need to leave that? Is that a discretion of the executive committee to be able to, you know, reallocate that? Or is it something we want to add more to? I just don't know what the purpose is. And at 600,000, it doesn't seem like you're gonna do much in the way of capital, so. But it's a big number as it relates to like the proposed fund balance use this year would more than cover that, so. And then on top of that, it looks like a decent fund balance usage if we were to approve all the requests. But with how large our fund balance is, you know, you're only talking 10 to whatever, 15%, which is sustainable for 7 to 10 years. But I don't know what the healthy number is. It seems like we're not, you know, we're not a government entity that should have that much fund balance. And I also get concerned from a state policy perspective at some point, if you have that much, you have over a year's worth of revenue sitting in fund balance, at what point are they going to say you're not using it? Let's take that back, claw it back and use it for something else. So I know that's a lot of questions there, but I don't know if you've heard anything through your probation groups that could help us formulate, you know, response to that.
I think we've had that discussion before, and I think in the strategic planning retreat of some of those things of like, yeah, you don't want to have too much because then when times get tough, the state will say, well, you're not using the money that you already have. That happened a little bit like with the pretrial piece, and part of it was like a lot of counties were standing up things, so it takes a while to stand things up and they want to spend it in the first year. But yeah, I mean, I know we have Aaron up here. They can probably chime in on this
So
too.
one last
Right.
question for Aaron, is this interest bearing and where's the interest going?
It goes back to the general fund. We don't keep the interest on this.
So at 3%, 2%, general fund's making, 80 to 120 grand a year.
So on the fund balance piece, I know Aaron and I have had this discussion before of like, some people say 15%, some people say 30%, some people say years, like there's different schools of thought on it. Yes, this is definitely right now, if we spent over, I think I calculated out, it's like 8 years at this spending rate, just based on the current revenue now, which is a lot. So do we have a plan to spend that down? So I don't know, Aaron, if you want to give your fund balance philosophy or not.
Happy to. I think as long as this group decides on why the fund balance is there, then you can justify whatever the balance is. So in other words, if you agree that you want a 1-year equivalent of fund balance on hand to wind down any CCP activities should the state eliminate the funding source, that's a justifiable reason to have a significant balance. If you want less than a year, if you want 6 months, 2 months, whatever, as long as that's, written down somewhere and agreed to, I think you can justify having as much of a balance as you need to. It's when you don't have a plan to use it and you're scrambling that the state's going to come ask you, and they might anyway, but they're going to ask, what's the purpose of the fund balance and is that the best use of funds? So not to totally kick it back to this group, but it really does depend on like what is the goal of the CCP and how do you want to manage that uncertainty?
And I wouldn't say we're abnormal. I mean, I think there's, you would know. Yeah, I mean, there's a lot of counties that are in this. I mean, in larger counties that number is significantly larger, like they're building buildings in downtown areas and stuff like that with this money. As far as the 600,000 goes, I mean, that predates me and I think it predates most people being on the exec committee. From what I think what you told me was that it was squirreled away initially thinking that nobody knowing like what would happen. Like, is the jail population going to quadruple? Is, like what's this new thing going to be? So it was put aside should that need to rise. And then it never was accessed. So moving that around, I'm not really sure.
And in fairness, that's enough for maybe a study.
Right. That was my point is it's like, if that's an important aspect of CCP dollars, we should maybe at some point evaluate using some of the fund balance and transfer it into something, or if we're just don't see a need for a project. Maybe that's another reason to keep fund balance higher so that when you do have a need, you could assign it. Just letting it sit there year after year at 600 just seems like it's reserving it off, but for what purpose? It's probably not for today either. Return budget discussion.
And so as we go through this, the other thing that I wanted to think about was based on the request as things shift, and this might be a better question for Ryan, but traditionally, like a ton of money at the very beginning, 2011, was treatment dollars, like millions of dollars, treatment dollars, and then there were changes in Medi-Cal that made that not as necessary, but now there's potentially other changes in Medi-Cal that might make it harder for folks to access to be on Medi-Cal. So it's just the idea of like, to think about some of those costs might increase if we want to continue people accessing services, should they not be able to access the same revenue stream. So we want to give a short little.
Sure. I mean, like one of the reactions I have to some of the existing programs as well as new programs is that some of these services are potentially billable. Like to your point, some of the things that we pay out of pocket because it's more convenient to access that way are things that could potentially be sort of transitioned or at least partially offset if we could figure out ways to work them into the Medi-Cal system. upcoming with changes with HR1, the federal reconciliation package that changed eligibility for Medi-Cal, and some of the hoops people have to jump through to get that are projected to result in a reduce of the number of people who are on Medi-Cal in our county to the tune of probably several thousand. So you'll have less people that could potentially benefit from that. But I will say, I don't feel like we've exhausted the possibilities of building Medi-Cal. So there are some places where we're building zero. And so even if it's a reduced population, there's still potentially money to be out there that could allow us to be more creative with our funds rather than paying for things that could be worked into an existing system. So
Yeah, and I mean, just said I try not to understand Medi-Cal that much, but in my head, I think of like probably the first ones to be ineligible are a lot of the folks that are on probation that are male, middle-aged, no kid, type of folks that were previously ineligible when I first started.
the expansion population is where a lot of these requirements kick in. I'll say there's exceptions for disabilities, and so people who are behavioral health clients, which is where a lot of this billing would take place, are going to see less impact. So I think it's probably a mix.
I was just thinking of keeping that in mind of like how the dollar might switch coming up. And then the other thing that I was thinking was some of the things that we do, I don't know, but I'm thinking that maybe like Cal-Aim and some of those things with ECM and some of that case management piece might impact some of the things that previously we were paying for because those things didn't exist. So on the opposite end of the spectrum, thinking of how Cal-Aim might impact some of those case management pieces that we are funding that we used to not have. So just to keep that in mind as we move forward and see how that rolls out. All right, so the one adjustment to the summary that I sent out, we did ask, and the court is not here, but we did ask the court to be more involved. Some of our asks from probation, like the pretrial ask, is essentially a contract with the court. It's kind of a standalone service that we can actually opt out of, and they could go somewhere else and get pretrial services. So we asked for them to give that ask because they're the ones that are spending those funds, requesting those things to be done. So Angie redid the sheet and pulled out the pretrial ask and put it under the court kind of heading. So this year, Steve worked with Layla to put that request together and to determine how much they wanted to ask for.
That's not on the one that was sent out. That's on the updated sheet that's sent up here.
Just out of curiosity, so in your comment before, this one, like the whole point of CCP is realignment, right? To do that. So when the court gives this ask for pretrial, is that just on all pretrial people, or is that people that are potentially looking at that 1170 process? Because if we're starting to spend CCP money on things that are just out there, like we shouldn't be just paying for just an FTE. It should be like somehow relatable to the work behind, right? And I just like when I look through, even ours, we can improve on things too, like on how we specify like what those needs are, but it didn't always have this tie back that everything was tied to realignment. And it almost is like, here's something that we're just asking for because it'll help, right? And then it's like, but the goal should still be focused on realignment, right?
So we've been doing, that's been a discussion since 2011. And I would say most counties, and I can't speak to the discussions that occurred here back then, but it was kind of the saying of today's probationers or tomorrow's maybe 109ers, because like, if you don't give them the services, they end up becoming an 1170.
But if we go down that slippery slope, I could say anybody brought into the jail is potentially like an AB 109.
Yeah, and I would say there has been from the state, like it's not limited to that. So there has been a discussion about that, and they've determined it's not limited to that. And so just an added piece on like the history piece, and I think Angie might be the only one that will nerd out on this one, but Diane Cummings, who was like Jerry Brown's right-hand person as far as budgets and stuff like that goes, and had a role in all these different realignments. So she's rolling out like her memoir or whatever you want to call it, like her basically Bible of realignment next month. It has some office hours. It's going to share this. So that way, I think as she gets older, her idea was like these discussions will be memorialized forever, depending on how people want to go. I mean, I know that doesn't address exactly what you're saying, but it will speak to like what the thought process was around realignment, you know, in the room where it happened.
So I guess my big picture concern is like the state could just turn around and say, these are county functions that the county was gonna do anyway. We're gonna stop funding that. Because the whole point of them funding is that we're taking on this burden that the realignment created, that the state was originally housing. When we go away from that, the potential they could come back and look at us and say, well, you don't need that funding from us. Like you guys can run whatever programs you want to. And if it's not about realignment, then go ahead and pay for that, but we're gonna pull back funds. Like I just worry about that in the long term.
Yeah, I don't see it, seeing that they've already said that it's an okay expenditure, as well as the reason why that in SB 678 usually doesn't take as big a hit is because they've realized that they pay us a fraction relative to the cost savings that they're realizing. Like it's significant, the amount of money that they save relative to the amount that they hand over to the counties. So that's generally the budget discussion around those two funds. That there's no way, like they can't get a better bang for the buck. I mean, same with kind of like pretrial of like, if we said we're not going to do pretrial anymore, or if like there's no other entity that I'm aware of that would do $750,000 worth of work for $185,000 in the county and be like, sure, we'll do that. So, yeah, I mean, we can have that discussion. I mean, that's the way I've always viewed it. That's the way that every other county I've ever heard of has always viewed it. But it's more focused on the shift in approach to that group of individuals than it is the actual labeling of those individuals. But
Yeah, I mean, also like think about, you know, with the population, you know, being as small as it is in Nevada County as far as this population, like if you were gonna stand up like let's say a CPT group in the jail that was only for realignment individuals, I mean, it'd probably be hard to actually have, you know, the people in the seats for that. So that's kind of the same way we look at some of this stuff, is that we don't necessarily, not to mix by risk level, but, you know, we stand up a program through these CCP funds, but it benefits the entire population.
I mean, that would impact, I mean, yes, the economy of scale from those things, as well as two other things. Is one is, I think in 2011, the belief was these were like new people that we didn't know, you know, and then when they started coming out of prison or since 1170, we're like, oh, it's the same person that was on adult probation yesterday or on juvenile probation. It's the same group of people, as well as locally. Then that would impact, we pay for things like collaborative court and other things like that, where all those people in collaborative court are not AB 109 folks. All the people that go to eligibility that are criminal justice involved are not AB 109 folks. All the people that go to Project Heart or whatever, they're not all AB 109 individuals. So that would be a bigger discussion of how we would parse that out. I think it probably would be difficult given the data capabilities, but I mean, if that's a route we want to go down as a group, then we can go down that route. So,
But I think you could also, we talked earlier about the fund balance, and things like that. I don't think that there's a, you know, we're trying to spend some of that away to set these programs up. We're going to do potential an expansion this year that will expand the greater justice system in Nevada County. So I think those might be harder questions if we were looking at a huge budget shortfall. And I understand that if the state was coming after some funds and you don't know what's going to happen in the future. I mean, I get casting the wide net, like even though, you know, you'll have other people in there, like I think that's unavoidable, right? It's just that if there's no connection at all, it just seems off from the intent, that's all.
What are the requests that you think are off the intent? Can you give an example?
No, I don't have an example.
I mean, statewide, there's been a broadened understanding of what these funds are to be used for. And they've definitely approved it, gone away from them just being mandatory supervision PRCS individuals. So it's not something we in Nevada County are doing alone. This is a statewide.
Yeah, and I would say right in the first 2 or 3 years, it was a lot more like, we gotta make sure each person came through this one door, to get this one service. And those things have shifted over the years as we saw who the population was. All right, any more discussion on that? And so I'll go through the budget, and like I said, I'll start with the new things and the things that have increased. And so if you look at the probation line, I'll start with us. So the majority of the increase, and it's really not that big of an increase, but the majority of the increase was salary costs and an additional cost for some electronic monitoring. And so there wasn't any additional programs or folks or anything like that. It was just new MOUs and EM. So does anyone have any questions about that? And like I said, on the new one, we backed out the court request.
Is some of that EM cost on the pretrial side, or is it all
No,
probation?
we separated out the EM.
EM
for
pretrial is included in the pretrial.
On the court one?
Yeah.
Because the court is bearing the cost of that is probation as the contractor of the pretrial program.
Yes, sir.
The CCP wants, they want CCP to fund the courts.
And that's also not uncommon. I looked around and a lot of CCPs are funding pretrial because in every single count, I mean, just for the folks that we had a meeting with the court recently, some of you were there, but there were 24 county states that they had some extra money for pretrial. There were 24 counties that asked for extra money, and it was like a $13 million request. The court had $194,000 to distribute to cover that $13 million request. So needless to say, we didn't get any money.
The only thing that's interesting is just more editorial though, is that the CCP and AB 109 was 2011. Pretrial release programs and reduced or zero bail programs were significantly later. And the state has apparently not funded them to the level that's necessary. Yet now we're looking at this money to pay for it. It just seems a little.
Well, yeah, I mean, that's yes and no. I mean, in the previous county I was in, we had pretrial and it was pre-2011, so right at 2011.
Okay, Nevada County.
It came in, but I think a part of it is some of the changes in the laws and stuff like that. And yeah, and this is a big rabbit hole, and I'm sure Sheriff Moon has comments on this too. It's a weird thing to have like an entity that gives you directions to do things. That's a state entity that also doesn't control any of the money. Like to be in that like situation of where it's like, okay, statute says that the court can direct you to do these things, but you're not under the court. It doesn't have any obligation to fund any of those things. And it's just getting worse. I mean, there was a case law recently on the juvenile side where it was, and Alameda's taken it to the nth degree to where they're ordering like Airbnbs and stuff like that for kids that don't have a place to live and all these other things, because there was case law that said that if there's a child has a need, the court can direct the probation department to fulfill that need without funding that cost. So
Yeah, we have the same problem, of course, with like court security and bailiffs and transport and all those things. We're like close to $1 million short every year.
But you haven't asked the CCP for it.
Good point, thank you.
Maybe not this year.
Not this year. I mean, that's the slippery slope that you were talking about.
Yeah, I mean, that's
that comment, let's get the Grass Valley PDs in. 152,000.
Yeah. Believe me, I've been sitting here trying to reconcile the differences not on those. I mean, there's some, we could talk about that. And I think that, and what I just mentioned about like the evolution of AB 109, Sam's points about 1178 clientele versus your comments about, the likelihood for somebody to begin at this level and move into a higher level of sophistication or crime, which would then land them in higher level sentencing, anywhere from low level all the way to, state prison and all the 1170 stuff in between. I think that's that's a whole nother interesting conversation to have.
Well, yeah, because you think, I mean, it's getting off my framework here, but you think of it like from the, you know, a lot of this stuff is from like a medical model, and just as a personal experience, like years ago, I contracted malaria. That's a whole nother story, but my insurance didn't cover the medication to like, that was very simple, that is probably available in every third world country to cure the malaria that I had, but it did cover if I went into liver failure and all these other things that would result. You know what I mean? So it just seemed like a weird thing of like, you could prevent those downstream costs with an easy upstream kind of simple thing, or you can incur those costs later on. So that was kind of like the approach that I think of when it goes to these things.
So did you just wait for the liver to fail or?
Yeah, the infectious disease doctor walked down to the pharmacy and grabbed a bottle and was like, take these. This is stupid.
So before you in the Grass Valley PD request, it's the prescription.
Yes.
There you go.
That's just been wrapped. Thank you, Jeff. Thank you for that. I didn't see that one coming. We are making a request this year to definitely change the funding request from the CCP. In the past, it's been billable time related to involvement on the law enforcement side with the adult drug court clients. This role would continue with that, but looking to expand more of a case management, outreach, pre-arrest diversion program, to Jeff's point about being as far upstream as possible. This person would be a licensed clinical social worker who's also an officer for us, and would take on, as I mentioned, a very strong like case management perspective. There's data out of Seattle with their LEADS program that talks about the earlier you can have proactive street level case management and potentially divert incarceration in the first place, the more likely that you'll have successful outcomes on or lowered recidivism, future arrest. So that's what we're seeking to do. Oftentimes too, and I see this as through the coordinated CalAIM and the reentry program and stuff the jail's doing on trying to hook people up to services before they're released. A lot of the people I'm talking about here that this person will be working with are people who are going to have if they're arrested, they'd have a very short jail stay, more likely a book and release type of situation. And then what we've seen with those cases is oftentimes they are booked and released, arrested, booked and released multiple times until such time that maybe all their cases catch the attention of the court and they consolidate the cases, and then they spend more time in custody, which once we get to that amount of time in custody where they might have more intervention in the incarceration space, and then hopefully coordinated reentry, we're already hoping that that's going to be a positive outcome, but we're trying to reach further up into the stream here and work with people before they even have to go to jail, hopefully. Yeah, I mentioned some of the evidence-based stuff, all about just trying to link individuals with treatment for behavioral health, housing, sport, employment services and benefits for coordinated care. The outcomes desired are stronger community relationships and trust, reduced escalation of criminal behavior, improved information sharing among service providers, support for divergent outcomes, and then of course, housing and stability impacts. And then in my proposal, I just went through the CCP strategic plan and did all the areas, which I won't bore you with, but where it meets the objectives and desires of the CCP plan. And as it relates to future funding, we've been exploring a number of areas. As most people are aware, the current landscape of funding is a little bit difficult. I know our city currently is not seeking federal grants because of some attestations that need to be made. So that's hamstrung us there a little bit. And my hope is that if we can prove successful outcomes of this, that I can go back to our city and show them the need to continue something like this. I would see that being as somewhere between a 1 and 3 year project. I have a call this afternoon with a professor from Ohio State that we're going to talk more about how do you measure these outcomes. I mean, we all know there's some data points that we can look at, but how can we really build out an evidence-based program? Should this be something we can move forward with? And I won't take more time, but obviously, hopefully you read the submission and happy to answer any questions.
Isn't it the Ohio State?
The Special College of Evidence.
Right, is there any questions, comments, concerns?
I love it. Like, to me, it feels innovative, and it's amazing to me. They found a peace officer who's also an SXW, and I'm curious if the program is dependent on one person, or if there would be, like, if you would have a way, if that person should leave to hang a shingle or whatever, who would you have in that position? Who would you have in that role?
The way this model is modeled, yes, the ask is specific to having that certification. So should that person hang up the shingle, and as you mentioned, I think that, there'd be no billing for it, and frankly, we wouldn't have the capacity to staff that. But there's been a lot of internal discussions around the pathway to achieve this type of peace officer, whether it's social worker becoming police officer, or a model that we haven't seen, but it's an interesting one to look at, is peace officer becoming certified.
One of them was that, like, Ernesto is amazing. Was sorry to lose him to the sheriff. I'm sure they were sorry to lose him to GVPD. So sort of same question. Other questions I had, I think you sort of spoke to, but it's already a funded position. So why is the CCP picking it up? Is it to because the city's considering not funding it going forward, or what's the story on that piece? And then just to the general points I made earlier, are there components of this that could be billable things if they were sort of braided with existing programs? Like, you could, not necessarily to like the drug court interactions and things like that, but to the engagements with the people experiencing street homelessness, like behavioral health mobile crisis could potentially go along in a billable model that would support some of that work. And I think I have another question, but I lost it. Oh, and then the other question was it was just broader in terms of CCP impact for the entire system and the entire community. I don't know what the breakdown of, it looks like it's working directly with PRCS folks, but like, I don't know the proportion in GV versus the rest of the county, and yeah, just sort of that bigger picture, which may be more of a broader discussion.
Yeah, and start writing down your multiple questions. The first one on staffing, the FTE is currently funded. If this were to be funded, the specialty assignment would be funded, and we would backfill the patrol position that person is currently operating under. We've asked him to start doing some of this work to explore more about it and seeing that there's a need. But I think even like today, he's taking a standard patrol lead, which we struggle with on the staffing side, just to keep that staff. So that's that one. The one about billing, are you referencing Cal-Aim and whether or not it could be like a community support funded type of?
I mean, more to what I pointed out with mobile crisis, like for the stuff that is happening in the field, not happening with like drug court or like direct PRCS client support. Like, for any of your officers, like there could be a mobile crisis call, and then you could have a behavioral health clinician go out there who's actually connected to the system, can see their case history, can write 5150s if needed, and sort of do those things that are more integrated into the behavioral health system.
Yeah, which we're doing, and they're presumably billing for it. We are not set up as a billing entity. There's actually some discussion about whether or not we should be, and thinking about it more and talking to some of the service providers. What we didn't want to do is become a billing entity and then become the care provider, because then you're signing people like to us as opposed to somebody else, for example. And then hopefully you know, like the whole design here is having those relationships and contacts with the different service providers, many of which are probably billable providers. So whether it's mobile crisis or a non-government entity, still working, or the whole purpose is to work closer with those organizations from an individual and from a direct referral from an agency that is on the streets 24/7.
In terms of the scope, so I think the proposal references like working with drug court participants, working with PRCS folks, with those being just folks that are like Grass Valley residents or like anybody who's in drug court.
As it relates to drug court, that would probably be broader. As it relates to street level, it'd be primarily Grass Valley, of which people come and go across jurisdictional lines. That's just our, you know, their sensitivities about we wouldn't want to be without request working outside the city and vice versa. But the clientele wouldn't necessarily just be PRCS. I mean, I think it's really the desire is back to Jeff's comments earlier about, you know, today's arrestee is tomorrow's maybe 1 or 9 or probation or so. If we can try to avoid that from happening, we should be able to reduce the impact of the system.
I love the model. Clearly, our local team is significant service level in the county. My hesitation, I think, is, you know, we look at that integrated service in the because we contract our person, and we've looked at a model where we don't, where it's an FTE, and we've been told it cannot be integrated that way into the system. So they would not be able to write 5150, and they don't have the background knowledge of the person unless you're under that contract. So that's why we've stayed away from having an FTE in that role, because I will tell you the amount of knowledge from the person that's in the seat that's integrated is far more important than where are their hands, where are they going, and those type of things on those particular calls. We get the scene safe and the magic happens. So that's my hesitation, and knowing that there really isn't a model for that integration unless it's through the behavioral health system.
Yeah, without designated authority, the peace officer would remain with 5150 capability, not the 72-hour hold capability. This is unique in that this individual has been on the other side of the law enforcement role and been the clinician. I mean, that's probably a future discussion. I don't know that it would even make sense for them to do that, but it would be a significant expectation, as it already is in our organization, to use the county's mobile crisis team, and then as appropriate and as able, like we've partnered in the past with the sheriff's co-responder mobile crisis unit. And I see this as a little less like acute crisis, which I think is important, and this person has skills in it, but a little bit more on the case management as it relates to a vulnerable population, like more like proactive work.
Yeah, I would say, and mine's anecdotal. I don't have the data to go pinpoint, but just from the knowledge of the casework, predominantly a lot of the work is done with non-crime cases. It has nothing to do with the CCP and the criminal justice system. It's so unconscious. Could they commit a crime? I guess potentially that's the prevention piece. But a lot of it is the behavioral health. Just a really horrible thing.
Yeah, and I just want to reiterate that our focus is going to be a little bit less on the behavioral health side and more on the propensity for criminal activity based upon their situation. So like when you think about like street level homelessness in Grass Valley, a significant number of those folks are in the criminal justice system. And trying to reduce that as best as possible to even avoid them from moving further in, and or utilizing the criminal justice system where appropriate, but also creating the early connections to the service providers in the community,
I would
as
say
opposed to like the 911 crisis call.
county, I don't know if it's Beaver Hall, but HHSA, they've had people that have done that. They weren't even LCSW people, Jared Merrill and quite a few folks, and they would come to the jail, they'd pick people up. The difference is I think you start getting stuck when you have one, Grass Valley's small geographically, like compared to the 944 square miles. You are limiting, because that's one of the biggest concerns Phoebe always put to me on mobile crisis, right? Even with our contracted. And I was like, hey, if Grass Valley requests us, we're responding. If you know, so because that was always her concern is now you're not hitting the incorporated areas, right? In this case, it's the opposite. We're only hitting the small incorporated area. And then the big thing I see, having worked through this whole MC team for quite a while, like you have to have ROIs, you have to have all kinds of things to share information, and it is not easy. And so HIPAA is going to prevent the sharing of information. CGIS is going to prevent the sharing of information. And so it's going to become this isolated one man or two person team that can do things within Grass Valley, which is great for the Grass Valley people for sure. But it doesn't necessarily benefit, you know, all the municipalities or the unincorporated area either. And so although sure, maybe good dollar spent, it's going to be very isolated because where you guys mentioned, I think like jail reentry and things like that, like we had to have ROIs to share information and talk to people and do things. So if Ernesto wanted to be linked in, like with jail things, I don't know that we're going to just be able to do that. And so, you know, there's a lot more pieces to it. I just don't know if you get your bang for your buck. I do like the idea because I've been asking Phoebe for a long time. Can I just hire a clinician? Like this has been like over a year long, like because and not so much because I just want to have control of the clinician. We struggle with funding for the MCT year after year. What's that?
So we can't.
Yeah, probably not. But we love the resource, so I get why the drive is for it. The problem is if I employ like a clinician, they cut them off of the system, which is the whole point, to tie them into services, to get them to somewhere. Yeah, maybe like you can do an assessment like on scene and say, hey, my best is this, but now you can't even go and just give that to anybody unless you have like a pretty robust like setup. I don't know if Ernesto's planning on walking them to a door and walking through everything, but just as a
What do you mean, some system?
shared, like they're not gonna let us tie in.
I mean, I agree with all that. I do think though, for what the funding request is for this and what we're looking at, we are looking at a new program, and I think we're all agreeing on that. We don't really know what this would be, right? But we do know that for our homeless population and for who this is going to be servicing a lot of, they are going to be mostly condensed into the cities, right? And if we're going to experiment with this and see if it works, Grass Valley would be the place to do it. I mean, the other big one is Truckee, but Truckee, most of them, they don't winterize up there. So Grass Valley is where they're going to have the biggest population to see if this works. Their funding request, it's a lot of money, but it's not that much money to see if this is something that we can get headway on, it is my kind of opinion on it. And if it is, because I do hear what you're saying, where I think the biggest problem I've always had is the release of information and all that stuff, which is, in my experience, I don't want to be a big thing here, but it's more policy driven than actually gets a law driven. Because I do have a nonprofit too, and I argue with it. Our attorney always says that's not the case, and other people start to say that is the case. We share all kinds of stuff with law enforcement on our nonprofit, and you know, it's a lot of it is open to interpretation, I believe. But
you can do anything until you're sued.
That's true. And that would be up to him and what he wants to do and what they want to release. But I think that, you know, it's great having it with the sheriff's department because anybody can request anywhere in the county to have anybody do it. But if we're going to do like an isolated program to see how this works, it would make sense to me to be a municipality, and it would make sense to me to be Grass Valley. I did one thing you said there, Alex, and we haven't talked about this too much, but he said unless somebody requested it, we wouldn't be patrolling unless somebody requested. So I know for us right next door, we would be requesting. I could think of some people right off the top of my head. I'd be like, hey, can you? And one person that's very specific in town, he leaves a lot of signs throughout town. He does cross that mental health criminal line where it makes it very difficult for law enforcement to enforce it. But if they had somebody that had both pieces of it, I think it would make some serious headway. So as a pilot program, to see if this is viable and see if this is a benefit for our community. It seems to me like it's, would make sense to start it at this location. But it also makes sense, I think, that if you guys were gonna start it, it would make sense for the sheriff's department too. But I also think that the sheriff's department would be focusing that officer more on municipalities than the broader county. That, I don't know, that'd maybe be an answer that you guys can answer, but most of them just tend to be, we're on the root center. Which is,
Yeah, no, we have a lot of that. Yeah, I just think that as I've evaluated it, and I've had lots of conversations with Phoebe and her team, I've had my team do the same. Without the connectivity to behavioral health, you're very limited in what that person can do. So although I do think Ernesto has great skills, he's obviously licensed, that takes quite a while. You got 3,000 hours of actual clinical work and all these things to get licensed. Is that person somehow as like your homeless liaison, because they're not dealing with behavioral health issues. That's what I'm hearing. He's going to go out and help just try to tie people to services. What above and beyond is he doing that a peace officer can't do? Because unless he's going to sit and do an assessment, that's like really where our clinicians get in. They'll be at somebody's house. They'll conduct an assessment that saves the taking of somebody to a hospital. Whereas as a peace officer, if I go out, I'm like, person says, yeah, I'm gonna kill myself. You're like, off to the hospital we go. I mean, there's no choice. Whereas the clinicians will sit down and be like, hey, let's talk about this. And they'll go through a clinical assessment. When the assessment is completed, they can make a clinical choice to not take them to it, and they'll do different things. That saves the hospital and it saves the person because they stay at their house. They don't have to go for other services and things. Ernesto has those skill sets. He doesn't have the connectivity to the behavioral health system to
We don't
do the
have,
things,
we don't have the data connectivity, but there's.
but he can't legally do that unless behavioral health allows him.
Yeah,
to do certain pieces of that. But I guess my point was though, is that you were speaking specifically on adult drug court and homelessness type issues, not behavioral health type issues, which is exactly the whole realm of having a clinician. I just don't know why the clinician's required to do these things that like a guy like Jared Merrill, who wasn't licensed, I thought was really good at doing those things. Yeah. But he was really good at doing those things. He would link up, and there was somebody before Jared, and I don't remember who he was, and he was excellent. He left, they moved to like the East Coast, and he did, because the moment somebody gets released from jail and they're gonna go get in their tent, they would always tell me, as soon as they can get like free services and they can get drugs, they're not likely to engage with them as often, and that's where their struggle came. I just don't see where you get past, because you gotta address some of these behavioral health issues to get over that hump, to get them services, and that's really hard.
We're running out of time here. No,
You said we weren't gonna finish it.
I know. Not, but one thing I would say is every year, Alex and I talk about some evidence-based policing kind of process. And this, like, finally starting to get some traction in like, because it seemed like the funding, the 20,000 or whatever it was to go out and do some searches and go to some court hearings wasn't kind of like really getting at what the potential was. And so I'm guessing, since I think you have a call today, like there's more to it relative to some people with a lot of letters behind their names and other programs and trying to give some feedback. But when you first brought this up, the thing that I thought about was the thing that we all struggle with, and I'm assuming Callahan probably still struggling with, is those people that get 100 calls for service that are like the 1 hour bookings or the 1 day bookings or whatever you want to call them, like those quick turnaround people. And when we had briefly, I mean, this was years ago when we had the Myoker grant, when we ran the calls for service, it was these people that weren't hitting probation. They weren't staying in the jail for very long, if at all, but they were generating a ridiculous amount of calls for service, some of them 100 in a very short time frame, but weren't being attached to any services. And that's when Brendan first came in when he was working at Turning Point to try to connect with some of these folks. And I know Carmen does some of this if they get misdemeanors and they end up like the public defenders route. But that was kind of the thought that I had, was that like there's this subpopulation of people that cause a lot of work, but don't ever rise to the level to where they're getting the full-fledged kind of, menu of services.
Yeah, and they tend to fall through the cracks, yet they're most visibly in our communities, and Grass Valley has the lion's share of whether it's the point in time homeless count, whether it's the service providers that county and non-county that are within the jurisdiction. So that's why the fit. And again, this is not a behavioral health clinician model. This is a case management linkage to services, diversion from incarceration model. There are systems of care already as it relates to the crisis and behavioral health model that I think we would just further leverage through this type of program. But that's all I got.
And so, since we're running out of time, if we have just a couple of minutes, and hopefully we can do this in a couple of minutes, I think my new plan is we have two more that were increased, and if we could just get like a quick blurb as to why that occurred, and then we can do like we've done every other year and do a quick reschedule to do the vote. Because I mean, I don't foresee a ton of discussion on the other items because they're the same as we voted for the last several years. Does that make sense to folks? All right, so the two others real quick, the DAs, it went up. I know Jesse's not here, but if one of you could speak to it, I think there was a note about the temp employee not being around anymore, and so.
Yes, our request is because we are wanting to make this into a full-time position. We have two part-time positions that we're trying to merge into one. It is historically very difficult to hire a part-time temporary attorney. So we've had a retired annuitant in that position. They're no longer around, they can't stay any longer. So we are wanting to make this a full-time position to make sure that we get a very experienced and specialized attorney that we can keep on full-time. And that person will also be a part of our special victims unit. So hopefully they will have experience with working at domestic violence victims, which is part of our safety concerns and working with specialty courts. So with them having both of those dual specialties, we think it will bring a lot to the specialty courts and that position from our office.
It was, I think, about a 40,000 increase.
50,000 or so? 51. And that will be for benefits, basically. It'll be the same amount of hours that we're devoting, but it will be to make that into a full-time position.
Questions? All right, and then the next one was Health and Human Services. There was a change, Steve can help me on this, or. There was a change, there was a VSO ask, that was a new ask. And then there was a shift in costs, I think, for the jail.
Jail-based therapists.
Therapists too.
It's an increase due to cost of staffing.
Yeah.
And Rachel just stepped out.
Rachel just stepped out for the VSO proposal. What I would say on that one is, like, to me, it's a small amount and it's a new thing, and it seems like something that would be more appropriate as an innovation application than cutting into our plan here, but I lost thread on like where we are in this innovation process and when that would come up. So.
And so, yeah, so that was another topic that I had the same thought about a couple of things. So like, the innovation doesn't have to be just a CBO to be one of the groups in here as well. But that was the other discussion we've had ongoing of innovation, one-time funding, ongoing funding, and all those kinds of things. So we need to nail that down as well. But first, any questions about the VSO spot or the jail-based therapist? Right. Again, like I said, I have innovation right up here as well. So next thing, I mean, take this stuff back, digest it. I'll work with Linda to try to set up a time that works for everyone to come back. Or at least 4 people to come back.
Can we talk about that right now? It might be easier to.
And you pull up mine.
Yeah.
Or my phone's not safe here.
Because there's a lot of things on people's calendars that they could miss, but we have no way of knowing that. And then we have like outside agencies.
Can I just ask,
We can vote right now.
if we vote right now, like, I mean, is there disagreement or like more information needed or?
Do people want to vote right now? We can do that.
We also need to address if we're going to include innovation expenditures next year. That was a You're going about it. The same amount that we've done in the past,
So we can keep it this, the simplest would be just keep it the same for now until we work it out.
20 and 20 in this most recent year, I'm pretty sure.
Does that improve the balance? We don't spend it, or do you just cut it back to 20 every year?
Yeah,
It stays at 20.
yeah.
So in the case of what you're talking about, like
It's on the back page of that.
I think we have a balance of like 130-ish.
Oh, it's like 185 if we expend everything from the two contracts this year. I think, and with my estimates of, well, 25, 26. Revenue. So we down to about 140 if we kept with the $100,000.
How much is the VSO piece of that?
30.
Just moving forward, you done with it?
I know.
I'll just say, like, in terms, like, I'm supportive of moving things forward quickly. I also don't feel like we've had like a lot of time to discuss these proposals. Like, I still have more questions and comments on what I feel is like a great idea where we've been raising some of the challenges we've been experiencing in the system, but like to work through that more, like, and questions about some of these other proposals as well. So like, I would welcome more time for discussion. I also have disquiet with assuming that we have a sustainable use of fund balance when the revenue we are projecting this year is based on a pretty political state budget and is a higher AB 109 revenue amount than we've had in recent years. So.
And so that, yeah, so that's the piece about the vote is if we vote on this and then we spend down an extra 600,000 and then I'm not saying that's locked in from now until forever, but once some of those programs start rolling, that puts us in a different position than we've been in historically.
Is there a proposed date that seems like it would work for people?
Is there a proposed date or is there a motion? I mean, it sounds like I've heard one say let's vote. I've heard one say let's not vote. So I'll take either of those.
See if there's gonna be a vote.
Yeah. I guess I could ask for a motion for a vote and then see if it goes forward, and if it doesn't, then we can set a date. That's probably the easiest way to do it. So is there a motion of those voting members? Anybody want to make a motion to vote on it today? As is, or with discussion and changing some of the things?
Do we get authority yet? Jesse, we still need Jesse.
We have Thomas, we have 5, right?
Well, I don't even have single motions, I don't have any votes yet, but
You had a quorum, you said.
yeah, we have a quorum. There's no motion. So, all right, hearing no motion, I'll take the silence as we're not voting today. So next date for that purpose, for further discussions and voting. And voting on maybe next year, carving out 2 hours for this meeting.
Do we need it by for the county purposes?
Workshop. No. For budget purposes, yeah, mid-February to be completely solid at the latest.
So what's out February? I could go on the 5th.
You're gone that first week.
You're 6th grade camp.
No, I'm conference. 12?
You have a SAC regional meeting on the 12th.
What time?
Yeah. I missed that.
A lot of chairs.
It was pretty open. Need to be.
He does.
Well, 1 o'clock?
If we get them to get back from their.
1:30? You could do 1:30?
Right, probably have, one month. So I could eventually, like, yes.
I don't know what's on his calendar.
It just shows. It's fine. We'll make it available. So we'll go for the vote. Yes.
Not-
I don't think.
Itself.
Well, that's a board meeting. I don't know if you.
Prioritize the sheriff said he's gonna be there.
Wednesday, the 11th could be a good afternoon. Wednesday, the 11th in the afternoon.
Going once,
All done.
Sure, fine. Does that work for you?
What time? 2, 1:30?
1 o'clock.
1 o'clock?
Yeah.
1 o'clock. It's gotta be.
Yeah.
Thank you.
Okay.
All right, can I get a motion to end the meeting?
So move. Oh, look, so there are people that can make motions.
Favor, say aye. All right.
So.
Oh, good.
Yeah.
All right, thank you. Thank you, everybody.
Yeah.
I know this is a lot of stuff to get through.
February 11th at 1.
Yeah.
Right?
Yes.
Yes.
Well, that's